let this be a normal field trip? With a friend? No way!
Cruising on down Main Street, you're relaxed and feeling good. Next thing that you know, you see it. Octopus in the neighborhood, surfing on the sound wave, swinging through the stars. Take a left at human testing, take your second right past Mars on the magic school bus. Alligator nostril, climb on the magic school bus. Make a plankton too.
Take that!
On our magic school bus. Drop the river of lava on the magic school bus. Such a fine thing to do. So strap your bums right to the seat. Come on in and don't be shy. Just to make your day complete. You might get baked into a pie on the magic school bus. Step inside, it's a wild ride. Come on, ride on the magic school bus.
I don't feel so good. What should I do?
Here, have some water.
What's in there?
It's just one of those airborne tablets. Just drink it.
Fine.
Where are we?
The magic school bus travels through Courtney's esophagus and into her stomach, then through her small intestine and large intestine, where it is absorbed into the blood. The magic school bus travels through her bloodstream toward the kidneys.
The kidney consists of 3 layers: the renal capsule, cortex, and medulla. The renal capsule helps maintain the shape of the kidneys and provides some protection. The renal cortex dips into the medulla, forming the renal columns. The renal medulla consists of renal pyramids whose apexes form the renal papilla. The nephrons are located in the renal cortex, with the renal tubule extending into the renal medulla.
Upon entering the kidneys through the abdominal aorta and renal artery, the magic school bus moves through the afferent arteriole and into the glomerulus.
The large afferent and small efferent vessels create high pressure in the glomerulus. The pressure pushes the filtrate out of the blood vessels into the Bowman's capsule, the first part of the renal tubule.
Along with the school bus, the filtrate contains water, ions such as sodium, potassium, and calcium, bicarbonate, urea, uric acid, and creatinine.
From the Bowman's capsule, the filtrate enters the proximal convoluted tubule, portion of the renal tubule where most of the reabsorption occurs.
During reabsorption, the peritubular capillaries reabsorb water, amino acids, glucose, and ions. Most reabsorption is a passive process, although some is active. Nitrogenous waste products like urea and uric acid, as well as the magic school bus, are not reabsorbed.
After reabsorption, the filtrate, which is hypertonic, moves down the descending loop of Henle. The water leaves the limb passively, while solutes remain inside because the loop of Henle is impermeable to these substances.
The hypertonic solution moves upwards into the ascending loop of Henle, where sodium chloride is actively reabsorbed. It creates a concentration gradient which causes the water to leave by osmosis in the descending limb. By the time it reaches the distal convoluted tubule, the tubular fluid becomes hypotonic to the interstitial fluid. Sodium continues to leave the distal convoluted tubule, the region responsive to ADH, also known as antidiuretic hormone. Then it moves to the collecting duct, then down to the ureter. The magic school bus mimics urea, so it remains in the filtrate to be excreted in the urine.
The ureters are about 25 centimeters long and begin as the renal pelvis. They join the urinary bladder from underneath. The walls of the ureter consist of 3 layers. The mucus coat is the innermost layer, the muscular coat is the middle layer, and the outer layer is the fibrous coat. Urine is moved along the ureter by peristalsis that originates from the renal pelvis. The magic school bus is shaken and pushed towards the bladder.
Seatbelts, everyone!
When the peristaltic waves reach the bladder, urine is moved into the organ. The urinary bladder is a hollow, muscular sac. It is made of transitional epithelium which is able to stretch when filled with urine.
Where are we?
The wall of the bladder consists of 4 layers. The inner layer is the mucus coat, which consists of transitional epithelium. The second layer is the submucous coat that contains connective tissue and elastic fibers. The muscular coat is the third layer and is primarily smooth muscle. It contains the detrusor muscle, which forms the internal urethral sphincter, which is under involuntary control. Contractions of this muscle prevent you from peeing in your pants.
The outermost layer is the serous coat. It is only found on the upper surface of the bladder. The process by which urine leaves the urinary bladder is known as micturition. During micturition, both the internal and external urethral sphincters must relax. Unlike the internal sphincter, the external urethral sphincter is under voluntary control. The magic school bus is released during this process and makes its way back to the school in order to discuss what they have learned.
Urine consists of water, urea, uric acid, and creatinine. It may also contain amino acids and electrolytes, depending on your diet.
This is what happens when everything works well. When the urinary system malfunctions, certain diseases can occur. One of the most common problems is a urinary tract infection. It is caused by infection of the urinary system by microbial agents, generally bacteria, but occasionally viruses or fungi. There are two main types of urinary tract infections: cystitis and pyelonephritis. Cystitis is characterized by inflammation of the bladder, along with dysuria, increased urinary frequency and urgency, and pain in the pubic and lumbar regions. Urine may become cloudy due to the presence of bacteria or pus, and in some cases, hematuria may result due to the bleeding in the bladder. Pyelonephritis is an infection of the renal pelvis and medulla. It is caused by bacteria, but can also be caused by virus or fungi. Cystitis, however, is mainly caused by bacteria. Some of the symptoms of pyelonephritis include fever, dysuria, pain in the groin or flank, and increased urinary frequency. Both are treated with antibiotics, but pyelonephritis is treated for a longer amount of time and with antibiotics more specific to the pathogen.
Glomerulonephritis is another disorder of the urinary system.
What's that?
It is inflammation of the glomerulus due to infection, drugs, or many other causes. It results in changes in urine composition due to changes in glomerular permeability. Some of these changes in urine composition include proteinuria, the presence of protein in the urine, hematuria, the presence of red blood cells in the urine, leukocytosis, the presence of white blood cells in the urine, and casts, clusters of cells produced in the kidneys. It is treated by managing the causative agent and adjusting to compensate for that dysfunction.
Urinary dysfunction can also result from damage to the spinal cord and brain. A disorder known as neurogenic bladder can be caused by these two problems, as well as many others. It results anytime innervation of the bladder is disrupted. Incontinence, or involuntary micturition, increased urination frequency, or retention of urine in the bladder due to a urinary blockage are all characteristics of neurogenic bladder. It is treated by catheterization and medication.
Diabetes is another disorder of the urinary system. There are three types, including diabetes mellitus, caused by hyposecretion of insulin, gestational diabetes, which is diabetes mellitus in pregnant women, and diabetes insipidus, which is caused by hyposecretion of ADH. Diabetes mellitus and gestational diabetes are both managed by dietary modification, insulin shots, and weight control. Diabetes insipidus is treated by giving water or 5% dextrose solution orally.
Hyperkalemia is characterized by a serum potassium concentrate of above 5 milliequivalents per liter. It can result from excessive potassium intake, inadequate potassium excretion, or maldistribution of potassium between intracellular and extracellular fluid. Its symptoms are muscle weakness, neuromuscular excitability, and sometimes ventricular fibrillation and cardiac arrest. Mild hyperkalemia is treated with dietary modification.
Now you know all about the urinary system. Thanks for watching.